Alright guys, this is the last few videos of anatomy of the breast. Today we are going to discuss about the embryonic breast development and surgeries, the reconstruction surgeries related to it. The first part of it is the embryonic breast development. Formation of the memorages. It happens around week 5 to 6 of the gestation. And the memorages milk lines appear as two vertical bands of thickened ectoderm. Thickened ectoderm, and happens around 5 to 6 weeks. Then these extend from axilla to the inguinal region. The memorages are the foundation of breast tissue development. In most cases, the memory-ridge involutes along its length, except at the thoracic region where the breast tissue develops. There are 3 points about the memory-ridge or the milk lines that we have to remember. Happens around 5 to 6 weeks. Appears two ventral bands, and those are the foundation of the breast tissue. And in most cases, memory-ridge involutes in the other parts, remains in this thorax. That's how the breast tissue develops. By day 49, 49 day, thoracic memory bud forms through ectodermal invagination. By day 49, thoracic memory bud forms through ectodermal invagination. The remaining memory line regresses, focusing development in the thoracic region where the future breast will form. 2 points about the thoracic memory bud. On day 49, by ectodermal invagination, the remaining memory line regress, focusing development in the thoracic region. Then the branching of the memory buds. Ectodermal invagination produce 15 to 20 solid buds that will branch into lactiferous ducts. These ducts develop within the somatopleuric mesenchyme, the connective tissue that forms fat, blood vessels and nerves. Okay, what do we have to remember here? Branching of the memory buds. How? 15 to 20 solid buds, they become the lactiferous ducts, and these ducts develop within the somatopleuric mesenchyme, and this is the connective tissue which makes the fat, blood vessels and the nerves. Right, the next part of it is the mesenchyme's role in breast development. What will the mesenchyme do? The somatopleuric mesenchyme supports the development of the breast structure. What do they form? They form the connective tissue, they create the fatty tissue, they enable the vascular growth to deliver hormones, allows invasion of the memory nerves. Again, somatopleuric mesenchyme, they form connective tissue, fatty tissue, grows the vascular tissue, and helps the invasion of memory nerves. Then the nipple formation begins at day 56. Day 84, primitive ducts will develop, and the canalization at day 150. The epidermis creates small memory pit where the future lactiferous ducts will open. 4 points of the nipple. What are those? Day 56, where it starts. Day 84, primitive duct formation. Canalization at day 150, and the epidermis will cause the mammary pit where the invagination happens, where the lactiferous duct comes and connects it to it. Then the perinatal nipple formation and the variants. The perinatal nipple formation and the variants. At birth, the breast development in both sexes appears similar. Male and female at birth is equal. Under the influence of fetal prolactin and maternal estrogen, breast tissue can transiently enlarge, sometimes producing witch milk. It's a temporary secretion. Failure of nipple formation results in ducts opening into a shallow pits. Ducts opening into a shallow pit like that. In rare cases, nipple may do not develop at all. It's a condition called athelia. What are the 4 points of perinatal nipple? At birth, breast development in male and females are equal. Fetal prolactin and maternal estrogen will cause transient milk production. Then, failure of nipple formation causes a shallow pit where the lactiferous ducts open into. In rare cases, the nipple may not develop at all, which is called athelia. Right. Then the next part of the video is the postnatal and pubertal breast development. In that, the first part is the male breast development. At birth, male breast tissue remains undeveloped with no further growth unless hormonal imbalances will cause this to grow. The hormonal imbalance will cause it to grow. So the males have no development at all, but the unnecessary hormones will cause it to grow. Then the female breast development. It remains rudimentary until puberty, where the estrogen, progesterone and prolactin cause the significant growth. EPP. The female breast remains rudimentary until in puberty, where the influence of estrogen, progesterone and prolactin causes significant growth. What happens during puberty? Duct elongates and branches into terminal ductile and lobular unit. Increased deposition of adipose tissue gives breast the rounded appearance. Breast changes during the pregnancy. Pregnancy causes the full maturation of the alveoli. So this will cause milk production. And human placental lactogen also help the milk production. Lactogen will cause the milk production. After birth, the prolactin stimulates milk production. Prolactin, which comes from where? Pituitary. Causes the milk production, while oxytocin triggers the milk ejection. There are 2 points regarding the breast changes during pregnancy. The first part is induces full maturation of the alveoli. Prolactin, progesterone, estrogen and HPL will cause milk producing structures. After birth, prolactin stimulates milk production. Oxytocin triggers the milk ejection. What are the postmenopausal breast changes? After menopause, the glandular elements of the breast undergo involution. It becomes small, shrinks up. and the breast becomes predominantly fatty. Breast becomes predominantly fatty. Those are the changes we will see in pregnancy and postmenopausal period. Then the next part of the video is the developmental anomalies of the breast. What are those? Polymestia, that's supranumerary breast. Polyethia, that's supranumerary nipples. Supranumerary breast, supranumerary nipples, right? Then amestia, that's complete absent of the breast tissue. Then amasia, where the nipple develops but no breast. Nipple develops but no breast. Okay, what are the 4 conditions that you have to study regarding the developmental anomalies in the breast? Polymestia, that's supranumerary breast. Polyethia, that's supranumerary nipples along the mammary line. And amestia, that's complete absence of the breast tissue. Then amasia, a condition where nipple develops but there is no underlying breast tissue. Right. What are the breast cancer diagnosis methods? First one is fine needle aspiration cytology, FNAC, fine needle aspiration cytology. It is minimally invasive. It only does the cytological analysis. It can also be used in symptomatic cyst. The white bone needle biopsy obtains large amount of tissue while maintaining the tissue architecture. It distinguishes between in situ and invasive cancers and helps to classify the tumor subtypes. Then the vacuum assisted mammotome biopsy allows minimally invasive removal of benign and some indeterminate lesions for histological analysis, avoiding the need for open surgery. What are the 4 methods of diagnosis? FNAC, white bone biopsy, vacuum assisted mammotome biopsy. Right. What are the methods of breast cancer surgery that you have known? Tumor excision, that's lumpectomy. It is used to up to 4 centimeter size of tumors. 4 centimeter type size of tumors. And it is always combined with sentinel node biopsy. Or axillary clearance. Typically followed by radiotherapy. So what's the first one? Tumor excision or lumpectomy. This is up to 4 centimeter size of tumors combined with sentinel node biopsy or axillary clearance. And sometimes it will be followed by radiotherapy. Then modified radical mastectomy. It removes the complete breast tissue with axillary lymph nodes. Preservation of critical structures like the nerve to serratus anterior, thoracodorsal vessels, and medial lateral pectoral nerves is crucial to avoid complications like winged scapula. There's no scapular control. Winged scapula. So what are the ones that you know? Involves complete removal of breast and axillary lymph node dissection, preservation of the critical structures like nerve to serratus anterior, and these can cause winged scapula. The best known surgical complication is the winged scapula. Why? The nerve to the serratus anterior is cut. Intercostobrachial nerve sacrifice. This will happen to numbness in the upper inner arm. intercostal brachial nerve sacrifice. This leads to numbness in the upper inner arm, commonly following axillary dissection. Well, this is one of the last parts of the video. We'll see you in the next video. Thank you for joining our channel.